uh, I want to welcome you to our third uh, shared office hour with Oregon Public Primary Care Association. I'm going to get your organization off the top of my tongue more quickly next time, Alex. But I am James Barta. I use he, him. I am from Oregon Eligibility Partnership. We're the part of ODHS that manages the one integrated eligibility system. And so I'm really happy to see so many of you here and some familiar faces. Thanks, Vanessa. And so it's we're here to answer your questions. And so we'd love to know who you are. So please, many of you are already doing this. Put your name in the chat along with your pronouns if you wish and your role in your organization. So I'm just teeing things up so I can then let our co-host, Alex Dietz from Oregon Primary Care Association, take it away.
Yeah, I was just adding my information in the chat, but I'll do that in a minute. Just a little bit about me. I'm the Medicaid program specialist at Oregon Primary Care Association. And I'm working from home today, and you might hear my cat in the background. She wants to have her own Zoom meeting today, so just bear with me if you hear her. Um, but my position is funded through a Kaiser Permanente grant, and it's to essentially ensure that FQHCs and the sister networks have access to information regarding the public health unwinding and the renewal process with everything that's happening with Medicaid this year. So yeah, I think if we want to go to the agenda, we can move on to that. Okay, and then so many of you possibly attended the webinar that was held earlier today that was sort of getting into this phase 3 of the public health unwinding and what changes are happening, what to look out for. There's a recording of that, and I'll let the teams who are handling that let you know how to access that if you weren't able to attend. We're going to do a little bit of a recap, but it's going to be shorter so that there's more time to have a discussion and maybe answer questions that came up that we weren't able to answer during that webinar. And maybe if like new questions are coming about as we're having a little bit more time with this information, we can handle those. So yeah, the biggest chunk of this meeting today is Q&A and really getting into anything that isn't really feeling a little confusing for you. So without further ado, I'm going to pass this on to our presenter today, who I believe is Sean, who's going to give us some renewal updates. So thanks, Sean.
Hi, my name is Sean McAnulty. I'm OHP's Member Communications Coordinator, they, them. I'm also the OHA comms lead for the unwinding stuff. So, quick recap of the slides we did earlier. There was also a whole OHP changes in 2024 section. Feel free to ask questions about any of it, but we're really going to focus just on the unwinding portion. So, one of the big things is that we are in that month 11 of the unwinding process. This is the initial 14-month plan that we had. We had the phase 1 front-loaded renewals that were more likely to keep coverage. We had some back-loaded ones that we needed more time for, and then we had the priority ones split across the process. At this point, the initial 10 waves of renewals have gone out, so we're mostly in wrap-up for those ones. If we go to the next slide, it's got some description of our plan for the remaining 107,000 renewals. You may have heard of these under the name Ex Parte, which is a reference to automated renewals, or OSIP-M, which is a program for people who are specifically disabled or over 65, or it's one of our non-MAGI programs that are based on reasons other than just income. For people affected by those renewal issues, as well as some others, totaling about 107,000 in total, we are awaiting a new timeline approval from CMS that we might actually get today, but there are updates coming to the system in May that will change how we process automated renewals and the notices. For those renewals, we are proposing to stagger them over 4 months. So we'd have something, it's a bit off of a quarter of each month. There's slight variations, but over 4 months, starting in June, we would send out 4 waves of letters. they would still get the same 90-day response and 60-day termination timelines as anyone else does during the pandemic. That means that a renewal in the first wave in June would have until the end of September to respond, and then if they're no longer eligible, they would close at the end of November. The final renewals that are affected by unwinding would be started in September, have until December to respond, and close in February 2025. That's still all a tentative plan. We're hoping to get approval on that from CMS soon, and we'll share that in our continuing through all of our channels as we get that final approval there. Other thing I got some additional information on that we can share with you since the meeting this morning is a little bit more about what's coming in that May system update. If we can go to the next slide. One of the main things is that we're doing with that May update is adding the system functionality to handle automated renewals individually. This gets back to that automated renewal issue we had over the summer, where the system in 30 states or more was not built to be able to handle automated renewals for an individual versus case level. So that means when somebody in a household failed the automated renewal, meaning there was some bit of information that didn't verify, the whole family would go to active renewal, even the members that could have passed the automated renewal process individually. That meant if they didn't respond to that renewal, then the whole family could close for non-response. The directive from CMS to all the states that had the renewal systems working like this was that they need to go through and figure out which of those individuals can keep coverage individually and which members actually need to respond. That way we're not closing people just for non-response when they could have kept coverage through the automated renewal process. So being able to look at that individually is one of the main changes that's coming. There are also a bunch of other changes to the renewal notices and the process for them. One of the main ones is that there's going to be a single notice replacing both the passive and active renewal notices going forward. This is going to include what action is needed, the due date, as well as the specific information that is needed to be able to clear a request for information, for instance. Under current systems, the letters for a request for information may arrive as two separate letters, one telling you that you've been renewed but still need to submit information, the other one telling you what information is needed. It's very easy for those to get separated in the mail, even though they're sent on the same day. So it's very significant change that's going into one notice going forward. That's going to clear up a lot of the feedback we heard early on about in the pandemic about that being very confusing for people. We're also no longer going to be using the renewal packet as it exists today. That's going to be combined into that one notice, and it's going to be something more pre-filled, let us know the differences and respond sort of idea. There's also a bunch of changes to the notices themselves to make for easier visual navigation, putting more information on page one. There's more information about reasons for decisions and closure reasons. So if you are, for instance, closing over resources for that OSIP-M program, it's going to tell you the resource limit that particularly pertains to you and what resources we have on file. So it's a little bit clearer as to why you're over income or over resources and by how much. We're also going to be focusing more on the benefit categories like OHP Plus rather than the program like Magi Adult Children's Health Insurance Program, OSIP-M, Healthier Oregon, things like that. That builds us the ability to have a custom message explaining non-change changes. For instance, we're still required to tell people that when you move from Magi Child to Magi Adult, when you turn 19, we're required to give you a termination of that program level benefit and let you know that you started the new adult program. Though within this new update, it'll give us the functionality to be able to add messages explaining that this is still within OHP Plus. Your benefits are effectively unchanged. You're just within a different program. Another significant change that's coming there is that most people who appear to no longer be eligible will receive a window to respond rather than going directly into automated renewal. For instance, if you've told us that you're over income before, this would now give you a, hey, we think you're over income, please review this, let us know if anything has changed. And if they don't respond, we would move to termination, but they're going to get that response window, which also results in more letters, more notifications arriving. That way it's not just one letter telling you you're terminated that may not arrive. So that's a significant change that I'm really glad to see as well. All that's going to combine to make the renewal process a lot easier. This is all in response to feedback we've received from partners like yourself during the process. So really want to speak to the value of the feedback team and getting all this to happen. I'm really excited for all these changes that are going to make it real significantly easier for a lot of people. If we can go into the next slide. This is our general description of the outcomes of the renewal process so far. We are 84% of renewals have been completed as of last week. Over 1 million people, 85% of the total that have completed the renewal process are keeping their same benefits. There's also 1.2%, or about 15,000 people, that have had a benefit reduction. That means going from OHP Plus to a Medicare Savings Program most commonly, though you could also see Medicare Savings Programs to Veterans Dental and other things where they're keeping some form of benefit, but going down a step in some form or fashion. We've also got 13.7% of people whose benefits are ending and need to look for other coverage. Those are often where y'all partners are supporting them, finding marketplace coverage or something like that. If we can go to the next slide, this one will describe what we're asking people to do during the process. So to start with, 92.6% of renewals have been initiated as of January. That is the total population that's not affected by the renewal issues. That remaining 107,000 delayed renewals are the only ones remaining. Out of that group that started so far, 67.6% have been renewed without action. That means they have been verified using the automated renewal process, and we didn't need them to do anything to complete their renewal. For 21% of people, they're getting the request for information. That's the pay stub request-like process. Other common ones include requests for ID cards, social security numbers, things like that, where we just need you to provide some information to complete the renewal. Another 7.2% of people are receiving the full renewal packet currently, which we are happy to see being combined with the full notice going forward, and that process will look very different and simpler for people going forward. And then 4.7% of people have proceeded directly to automated closure, which means that they've told us that they're over income, and we just go straight to the 60-day termination date. For that category, that's the one that was the last bullet on the previous slide, where they're going to start getting a renewal window, a response window going forward. So rather than going direct to automated termination, we will ask them if the information we have on file is correct for them first. So some exciting changes there. If we can go to the next slide. When we compare this to other states, KFF is a health policy organization that does this sort of comparison. Oregon's in second place for the lowest closure rate. You also see some states like Texas have a more than 60% closure rate. So this is a vastly different experience of unwinding than many other states are having. If we go to the next slide, we also see that Oregon is using that automated renewal process more heavily than any other state. So we've had to make some changes to it, those ex parte issues. We have managed to save more people from unnecessary paperwork and keep coverage that way by not needing folks to respond in the first place. So that's a really significant benefit to our clients and part of what contributes to our high renewal rates. As we look through all the strengths of how we're doing well, we also wanted to take a look at the demographic weaknesses where we see gaps in the process. If we can go to the next slide, there are some areas where we're seeing people responding less frequently when we compare the percentage of the population that a specific demographic is among the non-responses versus the OHP population as a whole. For instance, for houseless members, we see they are 5.5% of non-renewables, but 5% of the OHP population, which indicates they're about 10% less likely to respond to renewals. When we see things like that, we've been trying to get together additional responses. On our state level, we've been able to get a new ad campaign going. We've got a bunch of partner outreach going to reach specific counties, specific priority populations and whatnot. I've got the map here on screen. This is often helpful. This lines up a lot with historic trends in insurance rates and whatnot as well. But what we're really seeing is the areas we want to direct more of our resources and for partners to direct their efforts as well is people who are houseless, people over 65 years old, people receiving long-term services and supports, Asian and Native Hawaiian / Pacific Islander communities. And then regionally, it ends up being, as you can see, Greater Portland, Corvallis, North Coast, Columbia Gorge, Central Oregon, and Wheeler and Harney counties, which might not traditionally fall under Central Oregon definitions, but it's kind of that blob you see in the center there. So those are the areas we're trying to put extra response and effort towards on our end. We want to share that information with you all as well, since so much of our work is done through proxies and partners like yourself. I believe that's the main update series we had there. We also talked about a bunch of changes happening to OHP in 2024 in the meeting this morning. Happy to take questions about any of these things. And if we don't have an answer for you on the spot, we'll get you written responses. So.
Thanks, John. So now we're in the Q&A section of this meeting, and I wanted to first open it up for questions about either what the information that we had in this particular slideshow or anything that came up from earlier in the webinar. I'm not seeing any in the chat yet, but I'm going to give just a few minutes. And if anyone else on the team had anything to add to the Q&A intro, just let me know. I just wanted to also acknowledge there's a lot of people on this call who are subject matter experts. So, feedback and questions are like really appreciated in this space. So anything on your mind, I welcome you to share. And alternately, on the last slide, I think there is the feedback form, and maybe just having that up while we're talking, so people can have that to look on instead of our faces. Cool, thanks. I have a question about the earlier meeting while people are sort of still digesting the information. You had talked a little bit about some changes to gender affirming care and about there's the new rule that prevents denial for cosmetic reasons. And I had one question that didn't come to me till after the meeting, which was sometimes as a surgery will have like a need for a revision. And I'm wondering if this preventative denial includes revisions to any surgical procedures that are related to gender affirming care.
I feel like I want to go confirm that specifically. I haven't heard that question on hand, but from my understanding, that would it's if it's something that the doctor thinks is medically necessary for their mental health is a main contributing factor in all this, then it should be. Like generally, the reason what this really does is it's going to make the denial because this is cosmetic very rare for transgender healthcare. You do see that in a bunch of areas with OHP, like dental care as well, but that's going to become much rarer with transgender healthcare as opposed to having to argue that this is necessary for your overall well-being and whatnot. That's going to be kind of presumptively accepted as a necessary part of trans healthcare. So let me get you specific confirmation on the revisions, though.
Thank you. I appreciate that. I just have in my own community have had people experience where their actual procedure is covered, but then the revision they've had trouble with this sort of like it's just a cosmetic issue. So I'm just wondering if it's like in writing somewhere that a revision is also included in that. But obviously, if you don't have the answer today, that's totally fine. But just putting that out in the ether around that new update. And then I guess another question I had that came up from the earlier meetings, we were talking a little bit about uh, requests for information. And you just kind of like listed some of like what those requests might be. One might be pay stubs, but I'm wondering just a little bit of back info about what pay stub, like how many pay stubs are they needing? Are they needing to see like a certain amount of a time period? And how does that work with people who have flexible incomes? I'm just curious about that personally. So thanks.
Generally, you would submit at least a month's. That's a safe minimum. If you can't provide information, for instance, you just got a new job and don't have your first pay stub yet, attaching explanatory notes is going to be very helpful for any of these things. So if you only have one pay stub, for instance, and couldn't find another, attaching an explanatory note and explaining that the other information was unavailable, or in the case of an irregular income or the pay stub not being representative of your income, that explanation is going to be really helpful. So that would be my general advice, is to attach a written note if this differs from what you're trying to verify. You're trying to verify that current monthly income that's listed on your case, and if it differs from that, why is really the thing that would be helpful to include for that worker.
Thanks. We have a question in the chat from Susan Garcia. If people who get the new notices ask if anything has changed, who would normally be denied with the information in the system, don't respond, will their notice say that they are ending for being over income or not responding?
I'm gonna have to go take that one back, actually. I don't know the exact answer on that. These are
Yeah,
still
Sean, I
fairly far
know
out.
we discussed it in the system design, but gosh, I would hate to say the incorrect thing right now.
Then we have another question. And some of these we can get back to you about
Well,
answers.
I just
But
want to jump out. We have some other subject matter experts that have confirmed they're going to get a failure to respond denial.
great. Okay, and then Christine has a question for Sean. Where should we attach the note, through a secure email?
That would work. Scanning it and uploading it to the one system would also work. Attaching that note and dropping it off to a local office, any of the routes, as long as you can get it into that same file or whatnot, or whenever you're writing anything, sending anything in, it's always worth putting the case number that this pertains to on that information as well, if there's any doubt about it getting separated or something like that.
And I know we don't promote phone call as much just because of the wait times, but if you are speaking with someone, you should be able to just provide that explanation verbally over the phone as well.
Mm-hmm.
I have another question regarding just, as we expand all these paths for people to take as far as accessing care. So certain people are qualified for Healthier Oregon. Some people right now are only qualifying for Marketplace, but may be eligible for the Bridge program later. I'm just wondering, like, are there sort of like internal path points that help people direct to what's going to be the best coverage for them as these things roll out? Like I know that continued eligibility and the Magi expanded adult program are these sort of like built-ins to try to help with that. But if somebody gets a little bit like um, lost in the weeds or just doesn't submit the right information, is there any way to like get back on track, or how that's going to be handled? I know that's really a sort of abstract question, but it's something that I'm thinking about, is just trying to, you're working with somebody and you want to send them down the correct path. Like, is there going to be internal help through the systems to help guide them?
There's going to be some onus on the member to respond, though I think my first answer to that is we have additional windows for folks to be able to reopen their case without a new application if they respond within 90 days of the due date, for instance. You can also just apply for OHP at any time. There's no open enrollment period or anything like that. So if you think you're still eligible for OHP, reapply or talk to a worker and get that 90-day reconsideration option. That is one of the first things you'll want to do when you're terminated, is look at all the information we've got in that termination letter, see if that's accurate first. If it's not accurate, update your case with OHP. That either let us know the changes if it's not closed yet, or use those other two options if needed. If you're then not eligible for OHP, and that seems to be the correct decision, you can also appeal if you disagree with that as well, and if after talking, making sure everything's incorrect if you think it's an incorrect decision. But if you're actually leaving OHP, and that is the assumption, you generally first look at employer coverage, see if that's available to you through an employer, including a family member's employer if you're married or have a parent and are under 26, that sort of thing. Next, you'd look at Medicare availability. If that's an option for you, you're probably going to want to consider your Medicare options. Talking to a Sheba counselor is going to be really helpful in weighing all the different options you have, especially if you're retaining partial OHP or a Medicare savings program or something like that. And then if those options are unavailable for you, you're probably eligible for financial assistance through the marketplace, and that would be the main route to catch you, in which case Yellow Assisters are some of our best tools there. Though we've got the Marketplace Transition Help Center, the window shopping tool, a bunch of tools for folks to get help from there, as well as insurance agents, a bunch of resources. So did that answer your question? Oops,
Yeah,
sorry.
I think
Amy?
Go
Oh,
ahead, Amy.
sorry. Can I jump in just really quick? I just want to say that was a very great answer, Sean. But I think that for folks that are not, like, if you're just entering the landscape and like don't know where to go, that's going to be really challenging, especially as we add the extra layer of the bridge program, or OHP bridge, sorry. So what I would recommend is to start at the window shopping tool. Because on our website, you can put in, and our website is oregonhealthcare.gov. You can put in just a few pieces of information And it will tell you if you likely qualify for OHP or Marketplace, how much financial help you can get. And that will be updated before the launch of the bridge of OHP Bridge to include that pathway as well. So I think that would be a really succinct way to just kind of get an idea of which application to start with, so that you're not, applying for one, getting denied, having to go to apply for another, especially because for folks who might qualify for Marketplace and not for OHP programs, there are very specific enrollment windows, as Sean mentioned. And so we definitely don't want to start the path of like going through OHP and then getting denied, and then that could cut your enrollment period, down with the Marketplace. So we are really working hard to get people to the right place, hopefully the first time.
Thanks so much for that. Yeah, those are both kind of where I was trying to lead that part of the conversation of just like somebody who's entering and maybe like they're like, well, I might qualify, I don't know, and then they might actually qualify for bridge later. That's good to know that, they can go and it'll link them in that system. So thank you for that. And then I have a question in the chat, or just an experience that someone's sharing, that Susan says that I've had differing answers from workers as to when the 90-day redetermination period starts. Some say that 90 days is from when the RFI was requested. Others say 90 days after the denial. I thought it was within 90 days of the closure after the benefits end. If somebody wants to jump in on that.
Hey there, I forgot to introduce myself when I spoke the first time. Donald Arrington here, Medicaid Eligibility Policy Analyst here with OHA. The 90-day reconsideration period would start the day after benefits have closed. So that's when that 90-day clock starts. There is a 90-day RFI response period during the PHE unwinding. So those two periods may get a little conflated there. But that is how that is set up.
Yeah, there should be a 90 days to respond. Then you get 60 days of adverse action before we close. And then 90 days after closure, you have that reconsideration window, if that helps clear up.
That clear things up for you, Susan?
And if you're hearing otherwise, please let us know and we can look into it.
Well, and
It might be worth adding. So to that, we've been seeing some questions regarding the expanded adult program and why maybe someone wasn't evaluated for the expanded adult program when benefits hadn't closed yet officially. But here's the kind of caveat with that. If an individual is sent an RFI at renewal and they do not respond to that RFI by the due date, okay, and then their case is set to close and they enter their adverse action period, even if they respond during that adverse action period, if their case was closed due to non-response to an RFI, the system will treat them as a new intake if they respond during that time, and they will not be evaluated for the EX ADLT or the expanded adult program. So that is some nuance there.
And we are looking forward to putting together a training for partners specifically on all this complex interaction between NextELD and the move to OHP Bridge and how continuous eligibility interacts with that topic. We're top of our minds for y'all. So
I was actually going to ask about that because I saw that in the previous webinar you're talking about there's a open card handbook, and if there's going to be anything like that for as like bridge OHP Bridge happens, just
there's going to be a mid-year insert that we're going to add for that. So it'll be an insert that gets put into the member handbooks for all the CCOs and open card once that launches for the second half of the year. So it'll be a one-page edition there.
And then Susan, did that answer your question? I just wanted to make sure.
Yes.
Great. Let's see. since we don't have anything in the chat, something that I'm thinking about that you brought up that we're in this phase of phase 3, and you were talking about, we're doing really well, but some of the things that we should all be looking out for is the non-response. People who are like may fall in that category of non-responding because of houselessness, or because of maybe you're saying that some of the populations is like the over 65. And I was just thinking about, how tricky it would be to reach out to some of those demographics, maybe who aren't checking email, who maybe don't have a stable address. And if there's anyone in the room who works pretty directly with these populations and has ways that their organization or their clinic is performing outreach, just any insight would be great. I know I'm in Multnomah County, and I was talking with our team about you had presented the little handheld cards that have a lot of information of if you don't have a stable address, and I got some of those and handed them out at libraries, and just places that I think that people might be like just passing through, and I'm wondering if anybody else has seen any outreach in that capacity.
The document Alex is referring to there is a palm card that we made waterproof that's specific to homeless outreach. We did some efforts to get those to folks conducting the point in time counts, which are kind of like a homeless census, in advance of that happening in January. So if there are materials like that that would be useful to y'all, we really want to hear what else you could use. If you have additional ideas like that, we have the capacity to support you in doing that. Please let us know. We're all ears about that sort of stuff, particularly if it lines up with one of those priority groups we talked about earlier.
Yeah, I'm wondering, because I've seen a lot of the materials and they're great. I think they're very directed at, remember to check your renewal status and remember to renew. And like as we're entering this phase 3, I'm wondering if targeting some more like outreach just towards, did you lose OHP? I know there is some of that already out there, but just really honing in on the like, if you've lost eligibility, like here's what you can do. Just as we're entering this like towards the end, I was thinking about that.
Yeah,
like,
that's actually exactly what we're planning. We've got a
cool.
graphic in the works that's going to be focusing on that 90-day reconsideration sort of messaging, trying to get people to not disregard us because they've already missed that deadline and to reapply if they want to and whatnot, because it's less a preparatory get your address up to date in advance of renewals now to try to rotate towards, now that we've got the anticipated 8 extra months of unwinding, we're refocusing our message and got the budget and whatnot lined up for our contractor to be able to continue that work. So that was good news there. That's exactly the sort of thing we were thinking would be helpful for folks. If folks have other things that they'd like to see, that would be useful in the continued 8 months of unwinding. Again, all years there.
And when do you expect that that's going to be available?
Beyond English and Spanish, I'm not quite sure of the timeline for the full suite language ones. Within the next couple weeks, probably for English, Spanish, contingent on when exactly we get that CMS approval. That's hopefully this week, so fairly shortly.
Great. Christine shared that we have peers out in the camps who have been handing out the palm cards. Oops, just lost the meeting chat. Where'd it go? But yeah, it sounds like those have been really helpful. Anybody else using any of the materials that they're finding they're helpful, or any ideas for this like phase 3 of information we could be sending out? I know everybody's probably tired and it's lunchtime, but you have a whole audience here of people who are waiting to take your ideas. So just giving the floor.
And hi, this is Cassie. I am one of the engagement leads for the Oregon Health Authority and on the public health emergency unwinding. And I just want to flag that Our contractor Metropolitan Group does have the ability to do some customization for y'all. So if there is something in our existing resources, but you need it adjusted, even if it's just a slight adjustment for the populations that you serve, especially if they cross over with the populations that we are trying to reach out to from a non-response perspective, we do have the flexibility to ask that of them and to really tailor some messaging. So we really want y'all to come with ideas, even if you think it's not something that's within our power to do. We definitely want to make sure we talk with our contractor and make sure that we're doing everything that we can for y'all. So don't box yourself in is I guess what my message is.
Well, while people are thinking of questions, feedback to give, I wanted to also open up the floor to anybody who has any resources they'd like to share. Any events going on in your community that you want other people to know about? I'm going to try to find my little list. I know that, let's see. Yeah, so the Community Services Network, I believe I'm saying that correctly, posted a few events. So we have, there's something coming up on Thursday, February 22nd at Jason Lee Elementary on Northeast 92nd. That's 222 Northeast 92nd Avenue. It's the Black Brilliance Community and Family Resource Fair. And I think there's going to be people there helping with healthcare outreach. And then there's a community resource fair at the Lane Middle School on Saturday, March 9th from 11 to 2, and that's on 7200 Southeast 60th. And I'm going to pop these into the chat real quick. And
while Alex is putting those in the chat, I have a couple things to let everyone know. And first one is, hopefully it's not a big deal, but tomorrow morning, in case you didn't know, the one system will be down until 8 a.m. So we'll be down from 5 to 8. We are undergoing our annual checkup from our federal partners to make sure we're doing things properly. So that's the reason for the shutdown. But hopefully, like I said, everything will be back up and running at 8 a.m. And then I know the medical sisters hopefully are aware, but we do have a community partner dedicated call team that will be coming back online after a 4-year hiatus to respond to medical assister calls. We do hope to expand this to other people who assist people in the one system, but we're looking at how to structure that properly, and that could be in the next month or two. But just a reminder that community partner team will be starting up March 1st, and we'll have a team dedicated to responding to some of your more technical cases.
As a former community partner, that's really exciting to have back. That's going to be a seismic change for a lot of y'all. So very exciting change that we're excited to get to tell you all about. Thanks to everyone who put in work making that happen. That's been a long time coming.
We have a question from Susan. Are there any plans to provide more training for community partners? Oops, losing track. Sorry, I'll start over. Are there any plans to provide more training for community partners with assisting those individuals on the OSIPM and MPS that will be going through their redeterminations? I guess with understanding the new notices, what steps can they take?
Alex, may I chime in there?
Sure.
This is Deanna Simon. I'm with the CPOP program. And the answer is yes. And I'd say there are two pieces to that I would want people to know. One is that and I'm not sure this has been widely announced yet, but our CPOP team is changing our training plan a little bit, and there are going to be some required modules for new assisters that will also be available to existing assisters. And one of them is about helping people with non-Magi benefits. I'm in the middle of creating it right now. And on top of that, our CP focus team that James was just announcing, they have been an existing team working together for quite some time on long-term care. So they are very skilled at the non-Magi benefits and at the interview and all things non-Magi. So they are going to be an incredible resource for our community partner network.
Beyond the
So glad to
trainings
hear about that.
Deanna
Oh.
just described, we're also working on a referral guide for where to take your questions about specific non-Magi issues. For instance, if you have a question about the resource limits, if you have a question about choice counseling, where do you go to take those questions? That'll be useful both for partners as well as the public directly themselves. So yes, more support's coming for that whole topic as we get closer to those renewals starting in June.
And if somebody wants something in the meantime, we do have existing modules on those non-Magi benefits that are posted in group site in our training section. We have a lot of modules and a lot of content there, so you'll have to fish through it. But they are there, and there's a lot of deep information on both an overview of Magi and non-Magi, as well as going deeper into some of the non-Magi programs. So I hope that helps.
Great, Deanna. Thank you so much. And then there's also a little plug in the chat. Just if you have resources that'd be helpful for Keep Covered, they've added a form for you to access it. And then I just we're down to about 15 minutes. I wanted to talk. I think we're going to try to have a little bit of information on our next office hour, if this is correct, about the OHP Bridge program coming. We're working on trying to get some people to talk about that. In the meantime, I wanted to post the new Bridge website just in case you have questions in the meantime, or maybe scanning that website produces questions for our next meeting. Yeah, just to get people thinking, because I know it's not till July, but it's never too soon to start planning for this stuff. So yeah, just wanted to plug that. Anyone else have anything that they wanted to share with the group that might be a nice resource for them? I know there's also a community capacity building funds webinar coming. I'm going to pop that into the chat.
That'll be if you're looking to get involved in the climate or housing related services and be a provider, for instance. That's funds to support people doing that work.
Yeah, that's that second link there.
Looks like we've also got a question in the chat from Christine. With all the
Okay.
changes coming, are there going to be changes to the application on the portal as well? I'm guessing that refers to the changes coming in May. I think the safest answer there is that it's mostly changes to the notices themselves, though there are a few language differences we'll have in the one system. There are continuous changes happening to that system as well.
Yeah, I mean, the one system receives updates, all the time, so it's tough to say exactly. The focus of that update in May is really on renewals, redeterminations. But to Sean's point, there were some adjustments to notices in general. And once we have the design finalized, and that gets closer to release, I'm sure we'll have more information on kind of the exact changes that we can expect to see on those. So yeah, stay tuned for more information on that. I mean, I should add that the changes we're making is to hopefully simplify the notices and make them more clear based on a lot of feedback we got from community and other sources. So.
Well, I'll hold out just a couple minutes in case any last questions come in, and then we may be able to leave a little early today. Unless anyone else has anything they want to chime in on. I'm all out. I've asked my questions. And I really appreciate everyone being here today, especially if you've attended. I'm sure everybody's attending all kinds of meetings today, but if you've attended both meetings about the public health unwinding, we really appreciate your attendance and your questions and feedback. So yeah, and keep using this space if you have questions that come up that you weren't thinking about in either of these meetings. They happen monthly. So second Tuesday every month, we'll be here. We'll try to have as many subject matter experts as we can. If you have things you really want to hear about, we can try to design having the right people speak to whatever matters you're dealing with. So, really use those feedback portals. I put on the CPOP group side a submission form of if you have topic ideas. I can link after the meeting to that because I'm gonna have to find it. I'm not exactly sure where it is right now, but I'll link to that if anybody wants to submit ideas. We're always welcome to them. But things seem to be slowing down in the chat. I think I'm gonna let everybody go. How's that sound, James and team?
That'll work. I suspect it works for our guests as well then.
Okay. All right. Well, I hope everyone has a great rest of your day, and thank you so much for coming. Deanna says, can the feedback web form link be posted here again, please? I will try to find it real quick. Let me see if I can pull it up.
Alex, it looks like it's linked in the slide that you were
Oh,
showing, but
yeah.
it was a hidden link. So for those of us who don't have
got
the
it.
slides right now, it's actually
Okay,
very useful. Thank you, Cassie.
cool. Well, I'll stick around for a minute. Everyone's welcome to leave, just so people can, parse through all the different links we're sending you. But thank you so much for attending, and we'll see you next month.
And thanks so much for facilitating, Alice. Great job.